This is an ultrasound study of a female presenting with a history of cesarean section for her third baby 22 days back. 22 days back, and now this is the uterus which is in front of you. This uterus, the patient's urinary bladder is almost empty, so I have to give some pressure in this region. Now you see that this is a postpartum appearance of the myometrium. No question about that, and this you should remember always. Now what we are seeing is the anterior wall of the uterus, the posterior wall of the uterus, and this is the endometrial canal, in which you see an echogenic area hanging into the endometrial canal from the internal lining of the anterior segment of the myometrium near the fundal region. This is the fundus of the uterus, and the uterus measures approximately 10.9 by 4.7 centimeter, and the dimensions are normal, as you know that up to 11 in length, 11 centimeters in length and 5 centimeters in anterior posterior diameter is considered to be normal. However, you see that the shape of the uterus of the myometrium will be very different in postpartum period, postpartum uterus. This is a picture of 22 days old postpartum uterus. Now this is the cervix. Well, this is the cervix. It's normal in dimension. This is the cervix, and from here you can see that the endometrial canal is filled with fluid. This is the endometrial canal. This is the lower segment lower segment of the anterior wall of the uterus or the anterior myometrium. This is the lower segment of the posterior wall of the myometrium. And why it is appearing more bright than as compared to the anterior one is that as the waves pass through this fluid, their speed increases, sound speed increases, goes back and thus rapidly back, and then you see that you see this area more echogenic compared to this area, whereas both are normal. Now the endometrial canal pressing from the cervix upwards, here we are, is dilated and has blood within it, along with this black area, in fact, is fluid, which is blood, in fact, within the endometrial canal that measures 10 millimeters, and it measures approximately 9.7 from here. This echogenic area that is hanging from the anterior wall of the myometrium near the fundal region. This measuring 2.3 centimeter in length and 9.2 centimeters in anterior posterior diameter is this is the clot, small clot within the endometrial canal. However, the possibility of a polyp cannot be ruled out. Now the transverse section, in transverse section we see that this is the endometrial canal. It is filled with echoes, and there is, however, no evidence of RPOCs or fetal parts, retained fetal parts, though suspicion of when I go to the transverse section, I see a cystic area. This is a cystic area. Now, this is the transverse section of the uterus. Postpartum 22 days postpartum, post-cesarean section. And this is the endometrial canal filled with fluid measuring 10 millimeters, and this is an echogenic area hanging from the anterior wall into the, you see it is hanging into the endometrial canal, this echogenic area with no posterior shadowing, and this is the anterior myometrium, this is the fundal region. So this can be a clot or a polyp. We cannot rule out this possibility by transabdominal ultrasound. This is a thin-walled cyst that is filled with echoes in the region of the right adnexa. This is the cyst in the region of the right adnexa. This is the cyst, and the cyst measures approximately 5.63 centimeter by 5.38 centimeters, and I usually give an even number. I will say it is 6 by 6 centimeters, and it is full of internal echoes that is suggestive of either bleed or pus. So this is a tubo-ovarian cystic tubo-ovarian cystic area that we are seeing. And this is the uterus, anterior segment, fundal region, posterior wall. This is a questionable solid region, solid area within the, hanging into the endometrial canal, and this cyst, you can see it's not, had it been a simple cyst, it would have been as black as you are seeing this area, but it is not as black or clear. All this echogenic area you are seeing within it is the debris. This one are the internal echoes, thick echoes. And you see that there is strong back wall. The posterior, you see the posterior wall and the region posterior to the posterior wall of the cystic area. There is acoustic enhancement posterior to it. There are, now let's study the cyst only. This is the cyst. It's so thin. See the wall of the cyst. And when I give a sweep to the probe, it maintains its shape. it does not change its shape. So, and posterior wall enhancement is seen. The wall is in front of you, full of internal echoes. There are no calcification. There is no calcification, marginal or internal. Wall is thick. Outer covering is thick. This is the outer covering, this area. This is the outer covering, and see that it is full of echoes, which may be pus or bleed, and this is definitely either bleed or pus, and this is a tubo-ovarian cystic area, ecophyll cystic area, with posterior wall acoustic enhancement. As you can see, strong back walls, acoustic enhancement, full of echoes, thick wall, tubo-ovarian, right tubo-ovarian, and with thick walls. Its approximate volume is this will be an approximate volume. More than 100 cc or ml is the volume within this cyst. Now this is both the uterus as well as the. Now this ecogenic area hanging anterior to this cystic area is the fallopian tube. There is no solid element within it. There are no septa within the cystic area. So this is the case of postpartum uterus will dilate, mildly dilated endometrial canal that is full of internal echoes, as well as ecogenic area, small ecogenic area hanging into the uterine cavity near the funnel region from its anterior wall, and with cystic area in the region of the right adnexa that is full of internal echoes, is thick wall, and has posterior wall acoustic enhancement, does not change its shape with change in the probe position. So this is a tubo-ovarian ecophyll cystic area in a 22-year-old female post-cesarean section, and the endometrial canal is not relating to this cystic area. There is no fluid seen in the pelvic cavity, and there is no evidence of archaeosis, in fact, and there is no fluid around the cystic area or posterior to its wall. This is the hepatorenal, and I want to see if there is any fluid in this region. The liver is normal, kidney is okay, the gallbladder is fine. So Thank you.
सर फ्रेंड से कोई भी नहीं